Welcome to Live Pure, the podcast. I'm your hostess, Janelle Alexandra. Get comfy, settle in, as we discuss all things health and well-being. Be sure to like, share, and subscribe. Now, let's get to talking about living pure. Hi, welcome back. If you did not tune in from last week, make sure you go back because my guest for today is Rudy Dragone, the compound pharmacist, and we kind of stopped abruptly from our two-part series here, so we're going to get right back into estrogen and hot flashes and that kind of thing, but make sure that you're watching both episodes because they kind of join in together. And then if you go back at episode 4 or 5, where he was here the first time, we're talking again about hormone replacement therapy and the thyroid and how important the thyroid really is. And this isn't just for women who are going through perimenopause. This is really for everybody, including men. So welcome back.
Glad to be here.
All right, so let's get right back into the hot flashes.
Okay, so what is a hot flash? Basically, when a young person is having a normal cycle, the body sends from the brain a hormone called follicle stimulating hormone. And it sends it down to the ovary and it says, I want to volunteer. There's 100,000 follicles in each ovary, okay? When it sends that message there, like the first time you had a period, 9,000 or so of those follicles died.
Wow.
Okay, and then subsequently, every single month, there's a whole bunch of them that start to work, and then one takes over or two take over, depending on what your cycle is like. And when it starts to make or starts to grow, okay, think of it as a seed that starts to grow a grape around it.
Okay.
Okay? As it starts to grow that grape around it, it makes estrogen. As it makes estrogen, that estrogen is released into the blood. It goes back up to the brain, just like a thermostat from a air conditioner, and it says, we have estrogen. Stop sending follicle stimulating hormone. So it stops sending it. Around day 14, that grape makes so much estrogen that it creates a high peak. That high peak sends another message to the brain, and that message to the brain releases luteinizing hormone. Luteinizing hormone goes down, and that grape breaks. Now, the little seed, this is just for you to be able to conceptualize it. The seed is what goes down and you can become pregnant. Now you have a grape, and that grape's got filled with liquid. That liquid is just a finite amount of liquid. That's progesterone. So progesterone goes up on day 14 and then comes down. So when people say to me, when should I test my hormones? I tell them, I want you tested between day 20 and 24 because the estrogen goes up and it comes down, and here's 20 to 24, and progesterone goes up and goes down, and here's 20 to 24. So I got a good picture of where the estrogen is and where the progesterone is because of that cycle that happens. Now we're gonna look at 100 people in front of me.
Okay.
And I say, I need a volunteer. People in the front say, pick me. People in the back say, oh God, please don't pick me. Okay? Everybody conceptualize that.
Yeah.
You're 12 years old or 11 years old and you have your first period. You're 45. And every month from 10 to 11 years old until 45, you picked out a volunteer. Go back to that 100 people. Every month you pick somebody out. Eventually, who do I get to?
Eventually the back.
The people in the back, please don't pick me. You're into perimenopause.
Okay. That's a fun way of describing it. I don't want to come out and play.
I don't want to come out and play. They heard the message, okay, for a long period of time, never came up to the challenge. How well are they going to work? How well are they going to make the hormones? Not very well. So over time, you get these diminishing returns. So you look at a young lady, her skin is tight, high amount of estrogen. Her breasts are firm and perky, and then over time they just start to droop. Okay, why?
And this isn't necessarily from women who have had like children and breastfed. It's just a natural.
It's a natural course of events that as you make less and less estrogen, they start to get less and less dense. Okay, and if you make the right estrogen, then they stay at a right level. If you don't, then they start to get less and less as time goes by. But you reach a certain point, and the follicle stimulating hormone gets sent again asking for a volunteer. Nobody's there. So we need to send another message. Maybe you didn't hear me the first time. I'm going to send a stronger message. Now, let's say you had your significant other, okay? And I put you here with a big weight on your foot. Okay. But I have your significant other in the next room with earphones on. And I say, the only way you're going to get that weight off your foot, and it hurts, is for you to call that person in to take that off.
My marriage.
Okay? to take that off. You yell. They're not hearing you because they have earphones on. So how's your next call going to be? Stronger, louder. Maybe you didn't hear me. I said I need help. Follicle stimulating hormone. And again, and again, and again, and again, 50 times a day. Those are the hot flashes.
Okay. And does this affect the thyroid then as well in any way?
It does. Okay. It does affect the thyroid, because what happens is those surges of that hormone creates an enormous amount of stress on the body.
Heck yeah, okay? That's uncomfortable. I have to lay down and pull my shirt up, and it's just like waiting for the ride to be over.
And what happens is when you replace the estrogen and the estrogen goes back up, it thinks, I've gotten an egg to be able to function, therefore I don't have to send the message anymore. So getting the hormones up to where they're supposed to be, even once a day or so on and so forth, because, again, the creams only last about 10 hours, having those hormones up to a certain level shut off the hot flashes.
Interesting.
Okay, so, and when you don't have that high amount of stress, which pushes on your adrenals, which then puts more pressure onto the thyroid, okay, and that creates a whole slew of different problems. But remember, this problem is like a domino effect. This causes this, causes this, causes this. But you fix it the same way. You back it up. And there's no reason why someone has to live like that. If you give a certain amount of estrogen, those hot flashes will go away.
Well, I think there's so much misconception still. It was like, one study that came out in the early 2000s, or maybe even sooner than that, of taking replacement hormone therapy is what causes cancer.
Well, let's talk about that, because this is very important.
Yeah.
Okay. The wrong estrogen can cause cancer.
And now that's what clicked when you told me don't take the tablet of my DHEA.
Right, because what happens is if you contribute to the manufacturing of the wrong estrogens, then the propensity for having cysts, fibroids, and cancers goes up. Okay? So there's been a lot of people that argue back and forth, but this is the skinny, okay? There are 3 estrogens inside of the body, and they all have metabolites, except for estriol. Estriol is an end-stage estrogen. Estradiol can become 6 other hormones, 6 other estrogens. Estrone can become 6 other estrogens, okay, including estradiol. Including estriol. Estradiol and estrone go back and forth with each other, okay? You can stop that. You can take certain foods and certain supplements to be able to guide it one way or the other. For example, if I have a male who has, and I had this story of a young man, I don't know if I said this to you before, but he was 22 and he was growing breasts, okay?
No, we did not discuss this. It's a good one.
Yeah, he was 22, he was growing breasts, and it had been happening to him since he was 16. And his testosterone was 725, I remember, and his estrogens, the estrone and the estradiol, were up to 100. And that's 7.25 to 1, where you want the testosterone to be 40 times whatever the addition of all the estrogens are. Okay. When we took a SpectraCell test and we checked his vitamins, his zinc was in a toilet. Zinc inhibits testosterone from going into estrogen. So it was $3.98 at the time, this is going back almost 20 years, that we gave him for the zinc. And within 90 days, his testosterone went up to 800. Not much, just 75, but his estrogen went down to 20.
Interesting.
Okay, so now it's 800 to 20, 40 to 1. Okay, guess what happens to his breasts? His breasts go away. Okay, so now you look at it and say, well, wait a minute. If a male has his breasts go away because of the decrease in estrogen, Could it be that females' breasts also deflate due to the decrease in estrogen? Yes. Okay? So we are nothing more than animals that have these hormones. We're at the mercy of the hormones. Okay? So if you get the right amount and you say, I had one patient that called me up and goes, Rudy, we got to change this formula because I'm growing out of my bras. Okay, and I got all these beautiful bras, but I'm growing too much. Okay, well, let's bring down the estrogen quotient. Okay, a month or two later, she comes back, yeah, perfect. This is exactly where I want them.
So this is women, like Dolly Parton and a lot of Punky Brewster, where they've gone in and had breast reductions. There's other ways around that than just going in and cutting stuff out.
Right, and they were having breast reduction because their body was making too much of a particular estrogen. Okay.
So I wonder if I've always been low in estrogen then. I've never been big.
Okay, it doesn't. Like I said, I talk to people and I go, I don't want to make Arnold Schwarzeneggers. I don't want to make Pamela Andersons, okay? I always say return to yourself.
Right.
What makes you feel comfortable in your body. I don't want to use the hormones for breast augmentation. I don't want to use the hormone. I just want you to feel comfortable in your own skin. And it's funny because when you have the right amount of hormones in your body, people come back to me and say, am I a little on the chubby side? Yeah, but you know what? I feel comfortable in my own skin. Am I too skinny? Yeah, I am, but I feel comfortable in my own skin. And that's more important than anything else. It's the feeling comfortable in your own skin. So you say, it's a hard day, it's raining, but it's still a good day.
You're right.
And if you can have the amount of psychological benefits from having the right amount of hormones is phenomenal. And that's the biggest thing is that's the big thing I hear is I feel like I'm back in my 20s. I feel like I'm back in my 30s. I go, that's what I'm going for, to get people to feel good about themselves and where they're at. And
we could have a whole topic about feeling, right? We're not allowed to trust our own feelings or
get
in touch with our feelings.
And hormones make a big, big thing. I mean, I can't tell you how many women have come to me and said, fix my hormones or I'm going to kill my husband, okay? I think he's a bleep, okay? I can't say the word. Okay? He's a bleep. And a month or two down the road, he goes, well, he's still a bleep, but at least I can handle him. I can handle him because I'm not overstressed because of him. Okay.
I have family members who just drink in order to put up with their spouses.
Oh well, that's and that's it. That's another thing. What drinking does to your hormones. Drinking actually converts your testosterone into estrogen.
Oh, fascinating.
So you'll have some women that drink wine and then come to me and they say, I got really bad headache. Where's the headache? Is it from the wine or is it from the testosterone being changed into estrogen? Because too much estrogen can cause a headache. Okay, just like too much testosterone can cause a headache, but they're on opposite sides of the brain.
Okay, well, so far I don't have headaches, so I know that we're at a good dose.
Yeah, so you're at the right dose.
Yeah.
But that's again, all of these things play into each other. Do you have any other questions that you wanted to?
Oh God, I have a million. I mean, again, it's like we're sitting here talking, and I wish I was writing all of these questions down. This is why you have to come on regularly because you spark so much knowledge and interest, and like again, the growing breast in men. And one of the things that I would really like to have as a guest speaker in the future would be somebody who really understands the how food, especially plastics and like how that affects our hormone disruptions. And
that's a good question because let's take a hamburger. Okay, hamburger has a lot of estrogen in it. Okay, and you
now is this without growth hormones and all of that other stuff? It's just hamburger.
Just a hamburger can have a lot of estrogen, can have a lot of testosterone. It depends. And when I say a lot, it has some. You give it to a person. Let's say it's 10 milligrams, but just to give you an idea. Okay, again, I'm more of trying to give you a picture of what's going on in your body. You take a hamburger and it's got 10 milligrams of something in it, okay, whatever it is. And you're a young person and your level is at 200, 400, 1,000, whatever it is, high amounts. You take 10 extra milligrams, it's nothing. Now you take a person that's in menopause. and she has no hormones, and maybe she has 10 milligrams, and she's pretty much in balance, and now you give her an additional 10 milligrams, you've doubled what she has. So depending on the person, depending on where their hormonal signature is, certain foods can change. And let's not even get into the over farming that has depleted the soil and depleted the nutrients, okay? Because you look at spinach, for example, 100 years ago, 100 grams of spinach, which is 3 ounces, a little bit more than 3 ounces of spinach, would have 100 milligrams of elemental iron. Today it's got 1.
Oh, interesting.
Okay. One of the things I talk about is DIM, diindolylmethane. Okay?
I'm on that too.
Okay. Well,
Yeah.
DIM is great. Okay. I take it myself. I took it this morning, and I took Chrysin this morning, and I took zinc.
Yeah,
this
I'm on
morning.
that too.
Okay?
I love all the other things that you suggested. So it seems like DHEA is the only thing I have to put into a cream.
So I take them as well, and I can feel when I don't take it. At a certain point, when I don't take it, and I feel that I have way too much estrogen, or the estrogen starts to creep up in my body, that's when you start worrying. You know, and when a man has low amounts of estrogen, he doesn't worry. He just says, whatever comes, we'll
Like
take
your
care
guy
of.
with the car on fire.
Exactly, with a car on fire. We'll take care of it, okay? Whatever, you tell me what the problem is, and we'll take care of it. But when you don't, when you have too much estrogen, then you start thinking, what about this, and what about that, and what about this? And that's the reason why women are full with estrogen talk 3 times as much words in a day than men do, okay? They usually do 21,000 words a day, and men usually do 7,000 words a day. Why? Because women have estrogen. Estrogen
That's
is
why
making...
we just want men to listen. We just want you to sit there and listen.
Maybe you wouldn't have to say so much if we did listen. Probably it's because you have to repeat yourself 3 times.
Yeah. Okay, so back to the breast then. Again, I have a special needs son, and we've never medicated him for any reason, luckily. But I know that there's a lot of children out there who are taking certain types of medications for like ADHD or whatever it may be. And I've heard stories where they develop breast tissue for
Right.
even boys.
Right.
And is that kind of the same thing? Some of these medications are...
Some of these medications will interfere with their hormone production. Okay. And again, when you take it, I always tell people that if you see any of the symptoms, have a hormone test done. And then depending on where the hormones are, you can change it. You can change it by giving zinc, okay, and stopping the testosterone from becoming estrogen. You can take it by DIM and the Chrysin, okay. All of these things will change it. And if necessary, you can give testosterone replacement. Not necessarily forever, but for a short amount of time, okay? There are other things that can be done. Human growth hormone can be used, okay? You can boost your human growth hormone naturally by using 2,000 milligrams of L-glutamine and 2,000 milligrams of L-arginine, which I take at night, and then try to sleep 8 hours and fast for 12 hours. That boosts up, naturally boosts up your growth hormone without taking things like secretagogues like you were talking about earlier.
Yeah.
Okay? You don't need to do that, okay? And then if you give the precursors to the body, if you were deficient in those precursors, the body will then make exactly what you need, okay? And not over make it. And then you won't have any of those symptoms like hot flashes and things to that effect.
Interesting, yeah.
Okay, so it's more about, giving the body what it needs so that the body can then remake or do whatever it can. Now, in the cases where it can't do it, like a person that's gone through menopause and now you don't have any more ovaries, okay, then you have to supplement, and just to make themselves feel better. And I have one lady, she's got to be on the hormones now for over 20 years, okay, and she's on the bioidentical hormone. She goes in and she gets tested. She has nothing. She has no precursors for cancer, nothing like that. And she's 84, and she says to me, well, Rudy, maybe it's time I should start taking them. And I said, well, it's your choice, whenever you want. She goes, I'm going to stop taking them. I said, okay, well, then stop taking them. She calls me a month later. She goes, why didn't you tell me I was going to feel miserable? I said, I'm not going to try to push the hormones on you. Okay, you make the decision. I'm here to educate you. Okay, I give you all the information, and then you make that decision. When docs ask me and call me and say, I have this patient and they have this, and these are all the problems they have. I just give out information and then say, in my experience, this is what we've seen. Okay? Will this help you? I think it will help you if you do this, and this.
Right.
Now, try it. If it does work, great. If it doesn't work, we'll try something else.
Yeah, nobody likes to be told what to do.
No.
So all we can do is give the information and then they make the decision on their own.
When I teach the docs, I say to them, I go, 90% is how the patient is feeling, which should dictate how you run the hormones. 10% is the labs. Because if you have a lab and the range is from here to here, okay, and some people feel great over here, other people feel great over here. So it all depends on what the person is feeling. If you get them to feel good, and this is where their hormonal signature makes them feel good, leave it alone. That's what it's all about. We're only here for a short amount of time. 70, 80 years is a short amount of time. We should be trying to strive to feel the best that we can for as long as we can.
Right, okay? Yeah, and rather than the last 20 years of our life miserable. Yeah, I want to be here till 125, so we've got a ways to go.
Good for you. I mean, I wish I could make it that long, but who knows? In the future, with the advent of new technologies, we may get it that way. But I know I'll run out of money way before that, unless I continue to work till 125.
Yeah.
But I just want people to be happy. A lot of people come and they'll feel like they're in a dark tunnel. That's one of the biggest euphemisms I hear all the time is they say, I feel like I'm in a dark tunnel. And I look to the right and I look to the left and there's no way, I don't see where I get out. And then I give them a lot of knowledge and I tell them, I go, look into that tunnel again. You'll see a little bright light, together we'll walk out. Okay.
Oh, I love that. Together.
Yeah,
together we're walking out.
Together we'll walk out. You keep calling me and I'll keep answering your questions. And little by little we'll whittle. It's thinking like putting a square peg in a round hole. We have to whittle it, little by little until you get it to fit. And then it'll fit. But that's the big thing on hormones is you need tweaking. You need someone that knows what they're doing. You need someone that
I think that's one of the problems, though, is somebody who really knows what they're doing. And
it's hard.
I don't want to say anything negative about modern medicine to begin with, but it seems like majority of our primary care physicians just don't know enough about that. So when we go in, like for me personally, I've been seeing the same physician's office for 25 years now. And, I keep going in. They know that I have a history of breast cancer on my mom's side of the family. I'm not a smoker or a drinker, so I'm not worried about that for myself. But to go in and to even ask to get tested for hormones, they don't even understand what to look for.
Yeah, no, and now is a great time to say it. If you were to ask me what you should be tested for, it's anybody, male and female. These are the hormones I ask people to test, and that is estradiol, estrone, progesterone, testosterone, DHEA, cortisol, vitamin D, and a thyroid panel.
A full thyroid panel.
A full thyroid panel, okay?
And does that include the iodine as well?
If you can get it, yes, okay? But it's interesting. Let's talk about thyroid for a few minutes. If your T4 is low and you give iodine, okay, it'll boost your T4 to help build more T4, okay? When you give iodine, I recommend using like Lugol solution and putting a spot onto the skin so that the body takes what it wants. I am not a believer in taking things like iodoral, which is iodine that you take orally. If you look on the bottle, some of them say it's 3,333% of your daily requirements, okay? And when you were a kid, you got cut, you would put iodine on it to kill the bacteria. What do you think a high amount of iodine that dissolves in the gut is going to do to your good bacteria?
Oh, it's going to kill them right
It's
off.
going to, over time, if you're taking it every day, it will wreak havoc on your biome. Okay, but if you take it with,
could that be the same then of like the traditional table salt that people are over consuming?
Yeah, they don't have that. Doesn't have a lot of iodine in it. Okay, it doesn't.
My brain is just spinning right now.
And what happens is if you take it in kelp, for example, the seaweed, that's perfect because it's bound to the seaweed and it releases very slowly. okay? So it won't have enough to do damage to the biome, okay? So kelp is a good source of getting it. Even kelp capsules is a good
Okay.
source if you're going to take it internally. So that's increasing your T4. If your T3 is low, then usually you're due to a deficiency in selenium. So 200 micrograms of selenium for a certain amount of time will help convert the T4 into T3. If your reverse T3 is too high, okay, which would be Wilson's, okay, then what you want to do is you want to actually supplement with T3. So I'll have patients that have a high reverse T3, and Wilson's protocols are to bring up a person to 25 micrograms of T3 3 times a day. I don't do that. I'll recommend using like 2.5 milligrams 3 times a day, and then maybe going up to 5 milligrams 3 times a day. You'll have to do it for a longer period of time, but you don't run the risk of having the palpitations or any cardiac events, okay? So that's the easiest way to reverse T3. If you're TPO, Hashimoto's thyroiditis, if you have too much antibodies, okay? Interestingly enough, all of the we've taken care of about 30,000 patients over the course of 10 years, and that was going back 15 years ago, okay? But what we were able to find was we were going for anti-aging. We were just saying if a person's testosterone is from here to here, let's bring it up to the top 1/3 of normal so that people would be 30-something forever. That was our big thing.
Yeah, I like that motto.
And as I was doing that, as we were doing that, okay, myself and 21 other physicians, we found that certain patients that had autoimmune disease, like systemic lupus, multiple sclerosis, Hashimoto's thyroiditis, okay, when you got their DHEA level up to the top 1/3 of normal and kept it there for a couple of months, they reversed the autoimmune disease.
Wonderful.
So now when people come to me, I immediately say, where's your DHEA level? And DHEA level, they said, Mom, my doctor says it's fine. Their normal is from 30 to 330, and they're at 200. And they say, well, my doctor said it's fine. I said, no, I subtract the 30 from the 330, and it gives us 300, divided by 3, and now so 1/3 would be 100. Go from 330 down 100 to 230, and my range would be anywhere between 230 and 330. So if you're at 200, it's low. I push you into the 250, 260, 300 range, keep you there, and all of a sudden, 80%, not everybody, but 80% of the people, you see a reversal in some of the autoimmune diseases. So now you see somebody with Hashimoto's thyroiditis. I check the DHEA level, and it's like, what do the adrenals have to do?
Most of my clients all have autoimmune deficiency, so that's going to be the next question I ask them when they come in is, what's your DHEA level?
What's your DHEA level? Remember, DHEA is 80% of all the steroid hormones in your body is DHEA, okay? So when you say 330, and I tell people, I go, look at 5 cups of sugar. 5 cups of sugar, 80% of that would be 4 cups. If I have 4 cups as DHEA and 330 means all 4 cups are full, and you're at half of that, let's say 165, okay? And the doctor says, well, you're within normal range. No, you mean 2 of those cups are empty, okay? Think about that for a second, okay? So if you went to the cupboard, if you went to the gas station, if you're planning a trip, you know, and you look at your thing, and you say, oh, I got half a tank. What do? I go to fill up.
Yeah, I fill up at half a tank.
Okay, at half a tank, and I go, I got a long trip going. Before I get started, I'm gonna fill up. Okay, it's the same thing. This is life. This is the journey of life. You want to fill it up as much as possible, and when you do, you'll see that certain things. So going back to the thyroid, when you look at Hashimoto's thyroiditis, you have giving DHEA is a good probability that you're going to reduce the antibodies. So we got the reverse T3, we have not enough T4, not enough T3. We went through all of the things and what could be done to help. What happens when, if you said reverse T3, if you make a total, again, this is for a visual, a total of 100, and you send that T3 out or that T4 out, and only 70% gets to where it's supposed to do or is active, you're said to have, because of the antibodies, you're said to have this disease, okay? After you've gone below 30%, okay? If a certain amount of these T4 gets converted to reverse T3 and more than 30% gets converted, you're said to say you have Wilson's. What happens if you have 15 on one and 15 on other? Now you still have an overall amount of 30 that has been diminished, but you don't fall into any one of the diseases. You see what I'm saying?
That was my issue. Yeah, because my thyroid was almost nothing.
A lot of people have that. And so when I look at it and they say, okay, if you have X amount of reverse T3, let's say 25, okay, then you're said to have the Wilson's. But you only have 23. Well, to me, that means that a certain percentage have been destroyed, okay? And then you look at the antibodies, and the antibodies say, okay, if you go beyond 30, you have or 35, you have Hashimoto's, and you're at 30. Well, you've taken care of 23 here, 30. You only have 50% of what you're supposed to have. Okay, so
I'm only half of the woman I used to be.
So you need to treat both. You
Right,
need to treat
yeah.
both, and you say you don't have to be as aggressive as if one that was way over here. But if you treat both for a little while, okay, you can push those numbers back. And some people, when we push those numbers back, then they don't need to be on any medication anymore. Okay, I've had people that we've changed the reverse T3 down to almost nothing, and then they just stop the medication because they're back to normal again. So it's not about just maintenance, okay? In some patients, if you find out what's wrong with them and correct that situation, and we're gonna go, now I'm gonna shoot to testosterone because I always talk about this one patient, and that is they had heavy metal poisoning. And we cured the heavy metal poisoning, and then they didn't need to be on testosterone anymore.
Yes, all of these environmental factors play such a key role in all of that.
You also have to check up for environmental factors.
Okay.
Okay?
Well, I'm so glad that you were able to come again, and I hope you come again really soon. Because
Whenever you want me, you just call me.
We're gonna have a million more questions.
Yeah, if you get questions, please let me know, and I'll be more than happy to answer them for you.
Well, thank you for coming. Have a great day.
Thank you.
Thank you for tuning in. And again, if this is your first episode of Checking In, go to last week's episode where we have a conversation, Rudy and I, and we're talking again more about hormones, especially geared towards testosterone, pellets and creams and injections and the whole thing. And then we'll see you here next time. So have a great day. Thanks for tuning in today. I hope you learned something new about health and well-being. Remember, your current position is not your final destination. Be sure to like, share, and subscribe to our channel. Definitely reach out with questions so we can discuss it in a future episode. Until next time, live pure.